Hello, hello. Welcome back, everybody. Welcome back to the CAT Scan Guru podcast. How are you guys doing? So I know it's been a hot minute since I've dropped podcast episodes. A lot has been going on that I'm going to share, and we're just going to get into, and then I'm going to dive in to part 2 of the 2-part series I started on TikTok when it comes to pitch and rotation time. So let's first get all the housekeeping stuff done. Well, Christmas is around the corner, and please don't come after me. No, I haven't started my Christmas shopping. Yes, I know it's terrible. However, life sometimes, and that's just what fucking happens. But I'm going to get to it hopefully by this weekend, even though I do have to work all weekend, but I'm going to make shit happen because I'm a mom and I just make shit happen. So plus, it is colder than cold and snow on the ground. So yeah, I am not a fan of that, considering that I grew up in the desert and I'm a West Coast person. Give me beach, sand, sun all day long. I'm good. So let's kind of get a little bit of housekeeping out of the way. So if you guys are interested in CT courses, because I know I've had a lot of DMs and things like that and questions, make sure you guys check out the show notes. I will list all the courses that I have available, and there are new things coming for 2026. So make sure you stay tuned to the next episode because I'm going to be releasing 2 episodes this week. So make sure you guys stay tuned for that. And I will have more on that. So if you're interested in courses, I make it very affordable. I make it very easy to follow. And the platform that I use, there's an app that comes with it too. So make sure you guys check out the show notes for all those. Make sure you guys subscribe to the show so you can check out when the next new podcast episode comes out. As always, thank you so much for everybody who has subscribed, has shared, has favorited, has continued to listen. And even if you're new here, thank you for making this podcast show possible, because without you, it just would not be possible. So also give me a follow on TikTok. I post a lot of educational stuff on TikTok, and I know I've kind of, slowed down on posting. It's just I'm trying to get some things in my life with better home, work-life balance and children, and they're getting ready to get on Christmas break here. So that should be fun. And I just have to entertain the hell out of them while they're home, from school. So make sure you guys check out the show notes. All that good stuff will be there. So let's get into today's episode. So in today's episode, this is part 2. I know you guys have been waiting for this, and I'm sorry it took so long. We're going to be discussing rotation time when it comes to CT. So this is part 2 of the 2-part series. Okay. So if you are a brand new technologist and you are unsure of what rotation time is, I'm going to give you the very easiest definition of rotation time. So rotation time is the duration the X-ray tube and the detectors need to complete one full 360-degree rotation around the patient. Okay, so that is what rotation time is. So it's how fast or slow your detectors and X-ray tube are moving inside the gantry. So, because those things move simultaneously because of slip ring technology, which is another term, be another podcast episode for another day. So why is this important? Because this is a very important factor when it comes to our image quality and the exams that we do. So your image quality and your dose is always affected with rotation time, depending on how fast or slow the X-ray tube and the detectors are moving. Okay. Now, what are the effects of rotation time? Because different exams have different rotation times, right? So the effects of whether you have faster rotation times or slower rotation times, and I'm going to go ahead and explain both. So faster rotation times, what happens is they reduce any image artifacts, any blurring in your image, and it gives you better temporal resolution when it comes to your image. But it also comes with higher radiation dose. But now with modern scanners and just how technology just keeps advancing, now we don't have to compromise so much image quality due to different types of technology that keep coming out. Typically, when you use a faster rotation time, yes, it will increase your radiation dose to the patient. Now, when you have slower rotation times, that does increase your image artifact, the blurriness, the image noise, all those things, okay? But it does lower the amount of radiation you are giving your patient, okay? Now, these two factors, along with pitch, do go hand in hand, because when those two factors are incorporated, it can affect how better or diminished your image quality is, or how, lower or higher your radiation dose is. Okay. So typically in exams, the range of rotation time usually averages about to a 0.5 to 1 second rotation time, depending on what type of exam you are executing. Now, the times that we do have like a rotation time of like 0.2, 0.3, it's usually when we're doing cardiac scanning, because we want to minimize the movement of the heart, because, the heart is beating fast. Okay. Or, when we give the beta blockers, we slow down, the heart rate so we can get a nice clean image. And that's why we need faster rotation times when it comes to cardiac imaging. Now, also with chest imaging, like when we're doing PE studies, we need a faster rotation time because we want to minimize the movement of everything that's going on in the heart, in the chest, the lungs, you name it, right? So those are very important factors. Now, another exam that we typically use a faster rotation time is for neuro exams, like your CTA work, your CTA head and neck, your perfusion studies, because we want the nice temporal resolution, because you want to see all those vessels in the head and neck. And you want to see the brain perfusing to see if there is tissue that is salvageable or if there is dead tissue when it comes to stroke. Okay. So those are the important factors when it comes to rotation time. Now, when it comes to the factor of pitch, usually because you have an exam that you're doing, let's say, an abdomen and pelvis, and you need a faster pitch to get through the anatomy, you're typically going to have like a 0.5 rotation time when it comes to that. So usually they go hand in hand. Okay. And usually with cardiac imaging, you want a slower pitch, but you're going to have a faster rotation time, because you're trying to get that nice detail when it comes to cardiac imaging. Hopefully that all makes sense, because those things are important things. And these are some things that you should take away and make sure that you study when it comes to the CT registry, because some of these questions do get asked on that, depending on, what type of test you get thrown at. So these two factors go hand in hand, because you want good image quality. We're always trying to make sure that the patient gets the correct radiation dose, make sure that they get the lowest dose as possible, but we don't want to sacrifice image quality at all. Now, one tip that I can take away here is, as far as adjusting your technical factors, I do not recommend techs that are new, that have less than 3 years of experience, to be altering any technical factors unless you understand why why you're doing it and how it affects your image quality and how it affects your radiation dose. You have to know why and the effects of it before you can start doing that. Now, most of us experienced techs like myself, we know exactly why we're adjusting it and how to clean up that image, because sometimes we have larger patients that are over 400 pounds. And what we have to do is we have to try to figure out a way how to go ahead and clean up that image quality. Okay. And we have to figure out, sometimes we have to hit them at 140 kV, because a lot of the bariatric protocols do come with 140 kV. So we have to make sure that we understand why and the effects of not only your image quality, but your radiation dose, which is super important. Okay. So I made this episode kind of short. So just to make sure that you guys get all, the pieces of this, and knowing how rotation time does affect your image. And, when you're out there, on the floor. So when you're out there, working the job, and, you can take a look at your protocols and see what kind of rotation times you have and the different types of pitch, because every facility is different and the protocols vary from not only state to state, but facility to facility in every state. Okay. So hopefully this was helpful in this 2-part series. So if you want to know about pitch, make sure you listen to the prior podcast episode, because that is part 1, where I discuss all the things about pitch. Okay. Also, make sure you guys share, like, comment, share it with somebody that needs to hear this. And hopefully they do learn something from this. So thank you so much for joining me on this episode, and I will chat with you guys in the next episode.